The scapula, or shoulder blade, is a large triangular bone located on the upper back. It plays a crucial role in the intricate mechanism of the shoulder, connecting the arm to the body. This flat bone isn't just about structure, it's a platform for a powerful set of muscles. These muscles control the many movements of the shoulder, making reaching, lifting, and throwing possible. Imagine the scapula as a shield guarding your back while providing the strength and flexibility for a wide range of actions. The scapula's anatomy is fascinating. It features a prominent spine, a bony ridge that can be easily felt on the back. This spine extends laterally into a flat projection called the acromion, which forms the highest point of the shoulder. Another important feature is the coracoid process, a beak-like projection that serves as an attachment point for several muscles. Understanding the scapula's structure is key to appreciating its role in shoulder function and overall upper body mechanics. The scapula isn't static. It moves in concert with the arm bone, the humerus. This coordinated movement ensures smooth and powerful actions of the shoulder joint. The scapula's position on the rib cage, held in place by muscles rather than rigid, bony connections, allows for a greater range of motion compared to joints with more fixed structures. This flexibility, however, comes at a price, making the shoulder more susceptible to injury if the surrounding muscles are weak or imbalanced. The importance of the scapula extends beyond the shoulder. It provides attachment points for muscles involved in neck movement and stability. Muscles like the trapezius and rhomboids, originating from the spine and attaching to the scapula, help maintain proper posture and control head and neck movements. The scapula, therefore, plays a vital role in the overall stability and function of the upper body, influencing everything from everyday tasks to athletic performance. The scapula, while seemingly simple in its flat, triangular form, is a powerhouse of muscle attachments. These muscles can be broadly classified into two categories: intrinsic and extrinsic muscles. Intrinsic muscles, as the name suggests, originate on the scapula itself and are primarily responsible for movements of the scapula itself. Extrinsic muscles, on the other hand, originate outside the scapula and attach to it, influencing both scapular and arm movements. Among the intrinsic muscles, the rotator cuff muscles stand out. This group, comprising the supraspinatus, infraspinatus, teres minor, and subscapularis, originates on the scapula and attaches to the humerus. These muscles play a crucial role in stabilizing the shoulder joint, controlling the rotation of the arm, and preventing dislocation. Another important intrinsic muscle is the serratus anterior, which originates on the ribs and inserts along the medial border of the scapula. This muscle is essential for protracting the scapula, a movement crucial for reaching and pushing actions. Extrinsic muscles, originating from the torso and attaching to the scapula, play a significant role in moving and stabilizing the shoulder girdle. The trapezius, a large diamond-shaped muscle spanning the upper back and neck, is a prime example. This muscle has multiple sections, each controlling different movements of the scapula, including elevation, depression, and retraction. Another key extrinsic muscle is the rhomboid, which lies deep to the trapezius and connects the spine to the medial border of the scapula. This muscle is crucial for retracting and rotating the scapula downward. The coordinated action of both intrinsic and extrinsic muscles is vital for smooth and controlled shoulder movements. The scapula acts as a dynamic platform, its movements dictated by the intricate interplay of these muscles. Understanding the function of each muscle group is essential for diagnosing and treating shoulder injuries, as well as for developing effective rehabilitation programs. The scapula, unlike bones encased in more rigid joints, moves freely across the ribcage, guided by the muscles attached to it. This mobility allows for a greater range of motion in the shoulder joint, enabling us to reach, lift, and rotate our arms with remarkable dexterity. The scapula's movements can be categorized into 6 primary types: protraction, retraction, elevation, depression, upward rotation, and downward rotation. Protraction, also known as scapular abduction, involves moving the scapula laterally away from the spine, as if reaching forward to grab an object. Retraction, or scapular adduction, is the opposite movement, bringing the scapula closer to the spine, as in pulling an object towards the body. Elevation involves lifting the scapula superiorly, as in shrugging the shoulders, while depression refers to lowering the scapula back down. Upward rotation involves rotating the scapula such that the glenoid cavity, the socket of the shoulder joint, faces upwards. This movement is crucial for raising the arm overhead. Conversely, downward rotation involves rotating the scapula so that the glenoid cavity faces downwards, bringing the arm back to the side. These 6 movements, orchestrated by the coordinated action of various muscles, allow for the complex and versatile movements of the shoulder joint. The scapula's movements are not isolated. They occur in synergy with the movements of the humerus, the bone of the upper arm. This coordinated movement, known as scapulohumeral rhythm, ensures optimal shoulder function. For every 2 degrees of humeral elevation, there is 1 degree of scapular upward rotation. This harmonious interplay between the scapula and humerus is essential for maintaining shoulder stability, maximizing range of motion, and preventing injury.